Everyone good for us to start? Someone will give me a thumbs up. Very good. Today we're announcing that the Palaszczuk government has added an additional 43,000 hectares of land across Queensland to the protected area estate. That includes a mix of new and expanded nature refuges, as well as additions to a number of our much-loved national parks, including Dagular, Lamington, Main Range and Oakview. All of this land has now been formally dedicated by our Environment Minister, Meaghan Scanlon, who of course joins us here today for the announcement. The land includes areas that Queensland landholders have nominated to protect because they want to protect the critical ecosystems, plants and creatures that live within it, including here at this beautiful Mount Meaghan Nature Reserve. All up, our national parks, nature refuges and other protected areas cover 14.3 million hectares. That's an area double the size of Tasmania. And it's expanding the protected areas is a critical part of our plan to protect Queensland's environment and also protect our great lifestyle. It's our protected areas that attract tourists here to Queensland from around the country and around the world. And it's our protected areas that give us a fantastic opportunity to work with First Nations people on country, protecting their country and the critters that live on it. The Palaszczuk government is investing a record $262.5 million in expanding our national parks. As I say, the single biggest investment in them in Queensland's history. Here at Mount Meaghan Nature Reserve, you can really see how protecting our environment is a team effort. It's not just about making as much of the state national park as we can, but it's also about working with private landholders to revegetate their land and protect their land. And with the Nature Refuges program, landholders can plant trees in places, beautiful places like this, creating new habitat, protecting habitat, safe in the knowledge that it will be protected in perpetuity by our protected area estate legislation. I'm sure our Environment Minister, Meaghan Scanlon, will have much more to say about it.
Thank you, Deputy Premier, and wonderful to be at Mount Meaghan today. And I'd like to acknowledge both Ian and Christine for welcoming us here to their beautiful, beautiful property, and of course also Queensland Trust for Nature. As the Deputy Premier just said, 43,000 hectares of land is now protected in law. To put that into perspective, it's 430,000 Olympic-sized swimming pools. So this is a large swathe of land that is now protected for Queenslanders going forward. Of course, we know how important it is that we conserve these areas for future generations, but also to protect our rich biodiversity. Queensland has the most biodiversity in the country, and it's really important that we protect that and the threatened species that are within those. Of course, across the state, we have 1,000 national parks and protected areas. As the Deputy Premier just mentioned, nature refuges are a really important part of that. They are essentially private land holdings where the state enters into an agreement with those landholders to make sure they conserve those areas for future generations. And in return, we often provide grants and funding to make sure that they can manage those effectively. But of course, today's a really important day, but we expect to see many more days like this to come with the biggest investment in national parks in Queensland's history. We also have funding for threatened species, almost $40 million to provide important measures for protection for koalas and other really critical critters. And I want to acknowledge the work that in particular Queensland Trust for Nature is doing across the state, particularly in southeast Queensland, to try and protect koala habitat. So it's a really exciting day here today, and I might welcome now Ian and Christine to say a few words about this incredible property. Did you guys want to say something?
Sure. Come on. Yeah, we purchased this property a little over 12 years ago with the intention of indulging in our love of native plants. And when we came here, we suddenly realised that this was a superb piece of relatively untouched natural bushland. So we decided we were going to protect it. It's small by comparison with national parks. It's 100 hectares, but it has enormous local biodiversity. 600 different plant species, 130 odd bird species. So it's a wonderful little piece of land that not only deserves to be protected in its own right, but also helps to create corridors that enable animals and birds to travel from one piece of protected land to another. So around the edge of Mount Melham, there's us, there are neighbours like us who've got similar protections on their property. There's council lands abutting us that are dedicated environmental reserves, and they run into national parks. So between us all working together, we're protecting, hopefully, a stretch of local environment that is really important to the biodiversity of the Sunshine Coast.
And the thing I would like to say is that we are, and this community, and it is a community project around here, it's a snapshot of what's happening right across Australia. There are hundreds of thousands of people who are totally dedicated to the natural environment. And one of our intentions here is to bring in people who don't have much understanding of what it's like to just stand among trees, to get younger people off their phones, to get people really, really connecting that there's something here that's worth preserving. Because if we don't understand it, we can't preserve it. We're not going to be interested in preserving it. So part of our reason for being here is to open it to community groups who can use it for the benefit of others and for the ultimate benefit of the nature refuge and the nature area itself, the natural area itself.
And of course we're really excited to hear the additional lands that the government has now added to the protected estate. It's tremendously important to us and to a whole range of people that are committed to environmental preservation, to see these additional lands being protected and to see the financial support to landholders to manage those properly, because it's a very demanding task. As those of you who've got little pieces of property will know, it's not easy to keep these things under in good condition. So,
questions for these guys first, and then.
Sure.
Oh, actually, he's got a friend of mine.
That do.
How critical is that government support for what you do?
It's really, really important. For us, it's not the financial element of it so much. I mean, we're comfortably off, so it's not a major issue, but we get a huge amount of support both from the state and even more so from the Sunshine Coast Council. That brings in a level of expertise that we don't have. It brings skills, it brings understanding, it comes with recommendations as to how we go about managing the place. That makes a huge difference to what we try to do. And I should mention that for people who hold nature refuges outside regions like ours, our local council's really, really good. But a lot of councils don't provide anything like the support that we get. So the work that the State Protected Areas group does is tremendously important to them.
What kind of work is that you do? What kind of work? What are the activities, the measures that you take?
Oh, what do we do here? I do a lot of pulling out lantana by hand. We've planted, I guess, about 15,000 trees on this property, looking at areas that needed to be revegetated that were covered in weeds. So you take out the weeds, you put trees in, you wait 5 years till the trees create a canopy, and then hopefully all of the weedy grasses disappear. Sometimes it doesn't work quite that easily, but
So we both do a lot of work on weeding, and we grew probably 50% of those trees here, maybe not quite that many, And so there's something just really magical about collecting the seeds, germinating them, putting them in, watching them grow, and then putting them back in the ground, knowing it's local. The genetics are locally derived, and yeah, it's really lovely. Yeah.
And the other thing that's exciting to me in particular is learning to understand the extent of the biodiversity. So we spent a lot of time identifying plants, trying to find out what's here. We've identified about 600 species on this property, and birds and animals, and I go obsessive about insects. So if you want to know what moth that is, I can probably tell you.
In the time we've been here, Ian's identified over 2,000 species of moths, which is who knew there were that many? Not me, that's for sure.
Can you list them?
No. It would take longer than we have in this press conference.
No. Just for nature, did you want to say something?
I will if you, if that's okay.
Yeah, go for it, Sarah.
Thank you. Thank you. Thanks everyone. I'm Sarah Delahunty. I work for the Queensland Trust for Nature, and we're really proud to be a part of this work that we're showcasing here today. We're really pleased that we work with the government so closely on the work that they do around the private protected land areas. And we work really closely with willing landholders to do this. So we talk about the biodiversity. We're all about educating, all about protecting, and all about working with willing landholders to have that productive landscapes, and to increase that across Queensland is the work we do, and we're really pleased to be a part of it.
Very good. Thank you. Other questions? Well, I think everyone knows that building costs have been going up. We have a shortage of builders and a shortage of building supplies, and that is driving up building costs for everyone, whether that's people renovating their home, putting a deck on, building a new house, or indeed building a hospital. And so costs have gone up, but we will invest the funds required to deliver on those programs. These are funds that we are proudly investing in the healthcare of Queenslanders. And I've seen some of the comments from the opposition criticising those cost increases, and the question really should be for them, that in the current market, with costs increasing, if they would not invest those additional funds, what would they cut? How would they cut it back? How would they deliver less? Because if they're saying that they would keep it to the original budget, then there is no way they could be delivering these hospitals. But that's no big surprise, of course. They went to the election not promising to build any of these hospitals. They've never supported our hospital upgrade or construction program, and so they continue to criticise it.
Do you agree with the Victorian and New South Wales premiers that overhauling the health system is the most urgent challenge facing the country?
I've seen those comments and I agree wholeheartedly. The primary healthcare system needs an overhaul. It needs a massive investment. What we've seen over the last decade or so is the slow choking of the primary healthcare system. We've seen devaluing of general practice. We've seen a withdrawal of government support for general practice, and that has had impacts right across the entire health system, from primary to tertiary care. The inability of Queenslanders, particularly in regional, rural and remote areas, to access primary health care is putting enormous pressure on our hospitals. And it's not just in low acuity cases. What happens is when people can't access primary health care, they wait until it's too late. They wait until they get sicker. And so they present to hospital at a higher level of acuity than if they were able to access good primary health care with a general practitioner. And so I would like to see a real national focus on how we can improve the access for everyone to primary health care, because that is what will keep us all healthier, will prevent us from getting sicker, and also relieve the pressure on our hospitals, which ultimately are the last provider of last resort, the last gap, the stop gap. And if we can make sure that people can get the health care they need sooner, then we can deliver better care for every Queenslander.
We talk about access to health care under the satellite hospital program. 2 of them are not even going to be delivered this year as promised. So the people of Bribie Island are waiting at least another 12 months for their satellite hospital.
So in the case of Bribie Island, there were unavoidable land tenure issues that had to be resolved before construction could start. They were native title issues. Obviously, like anyone building anything, we needed to properly resolve native title issues before we could commence construction there. But I'm very confident that by sticking with what was the best possible location on Bribie Island, we can ensure that going forward, Bribie Island locals have the access to healthcare that we promised them and that they should have. It's a fantastic location.
Should more or all GP visits be fully funded by Medicare?
That's the kind of thing that needs to be looked at. I know that what people say to me is that it's increasingly difficult to find a bulk billed GP appointment. And that where they are able to access a bulk billing GP, it can take weeks to get an appointment. And of course that means sick kids getting sicker while waiting for an appointment, and some of them will need tertiary care because they get sicker. So yes, I think a key focus needs to be on bulk billing. If I think back to when I was young, my parents took me to a medical centre that always bulk billed. For everyone. And at the same facility we had GPs, nurse practitioners, x-ray, pharmacy, really everything that we needed in that one location, all bulk billed. Now that's not the experience that many parents now have seeking healthcare for their children. And so I think, for a long time, the universality of Medicare was what Australians loved about it. And I think a return to that as far as possible would be beneficial for everybody.
How much of a concern is that, and where do we go from here?
First of all, it's important to underline that those ratings are not measures of healthcare performance. They are measures of organisational performance. So they go to things like financial management, budgeting, that kind of thing. And it's really a tool that Queensland Health uses to determine how much support they need to provide to our hospital and health services. Of course, we want all of our HHSs to perform at the highest level of financial management, because ultimately that means they are delivering the best possible value for money for taxpayers, the maximum amount of healthcare to Queenslanders. And it's the role of Queensland Health to coach, mentor, support, deliver the support that's needed to those HHSs who might not have the level of performance currently that we would like to see. And we're constantly increasing our expectations on them, constantly calling on them to do more and to do better. And I think that's what Queenslanders would expect for health services that are ultimately funded with taxpayer funds. This system of rating performance was introduced under the former LNP Newman government and has been continued under our government. I note the comments from the LNP that this kind of information should be made public. It was never intended to be public when they introduced it. Indeed, it was never made public under the LNP. Queensland Health's records, even when I asked them now what those ratings were pre-2015, they were unable to tell me. So they're an internal tool used by the agency to determine how much support they need to be delivered to hospitals. It was a system introduced by the LNP that we have continued.
How likely is a cabinet reshuffle in the coming months, and is it time for a fresh pair of eyes in the health portfolio?
I don't think so, no. The Health Minister is doing a great job in what is a very difficult job. No one knows how hard that job is better than I do. The government, I'm not aware of any discussions along those regards. The Palaszczuk government is completely focused in 2023 on continuing to implement the promises we took to the people of Queensland in 2020, and we have a great team to do so.
Is it a bit of a poison portfolio to be handed health, do you think?
Oh, it's a tough job. It's more than a third of what government does, and one agency does it. So, and of course it's massive and complex and complicated and connected to just about every part of society. You've got, of course, the federal government's role as well as the state. So it's a big and difficult job, but it's incredibly important and incredibly rewarding. I certainly found it very, very rewarding to be working so closely with more than 100,000 people who dedicate their lives to taking care of Queenslanders.
How can the public be sure that more money for Medicare won't end up being defrauded and wasted as alleged has been happening?
I am very confident that the overwhelming majority of our general practitioners are motivated by nothing else than delivering the best possible care to their patients. Of course, where there is allegations of rorting, then that should be dealt with appropriately, but we shouldn't use those small number of cases to disparage the really important work of the vast majority who deliver the primary health care that Queenslanders and Australians need, and we shouldn't use that as an excuse to diminish the funds provided to them. We need to value their work, and to value it properly we need to make sure it's remunerated properly and that the systems and supports are there and in place to help them to do their job even better.
What about concerns by experts like the Grattan Institute that much of the federal government's $750 million to bolster primary care should be spent on multidisciplinary teams in general practice, including more nurses, physios, mental health clinicians and other allied health workers?
I think that's all true too. You know, I mentioned just now the support systems around GPs. You know, the work of our other health professionals is incredibly important too. We've seen an expansion in the work that pharmacists do. We've seen a increase over time in the number of nurse practitioners and the work that they do. That's incredibly important. Our allied health professionals such as physiotherapists, you know, all of them, the entire spectrum of health professionals are important to the healthcare of Queenslanders.
We had a near drowning last night at school, and we've had quite a sad start to the year already. Any thoughts on surf safety and any message to Queenslanders heading out into the surf over the holidays?
Everybody should follow the surf safety rules. Swim between the flags, check the warning signs when you get there. Be conscious of your own swimming capability and don't put yourself into danger.
Do you have the latest on COVID and whether there's been any increase in cases since the holiday period?
So what we've seen is, as expected, that decline in cases from the peak around Christmas time, but there's been a trend in the age of those cases. So there's been an increase in the average age of the cases that we're reporting. And as we know, older people are more likely to require hospitalisation. And so the numbers in hospital have remained relatively high, higher than you might have expected coming off the top of that wave. I know that today we have 1,617 new COVID cases, tragically 19 deaths. That brings the total number of deaths in Queensland to 2,468. We have 480 patients in public hospitals, 540 in hospital all up. So as I say, a increase in the age of cases has resulted in a lag in the reduction in hospitalisations, while we have seen a reduction in the number of cases.
Just on one other matter quickly. It's been 2 months since the Premier said the final plans for the GABA would be released in a couple of weeks. Have you seen those plans, and when will the rest of us get to have a look at them?
We'll continue to finalise those plans for the GABA. The crucial component, of course, is negotiating the intergovernmental agreement with the Australian government. Once we've progressed those talks, we will be able to outline more of the detail of our plans for the GABA. But as you'd understand, we really want to manage those negotiations sensitively. We don't want to undermine them by surprising the Australian government with detail that they should have had the chance to properly consider in the context of that funding agreement. So we'll continue to talk to the Australian government, and when those talks have reached a point where it's appropriate, we'll make all of those plans public.
So there's a delay with the Feds signing off?
We're continuing to talk to them. I wouldn't necessarily characterise it as a delay. Obviously, if there hadn't been a change of government, we would have been able to progress those talks more quickly. They've taken time to get their feet under their desks, get across all of the work that they need to do. So we've been understanding of that. We'll continue to talk with them, and we hope to finalise that 50-50 funding arrangement early this year.
The Lord Mayor said last month he's concerned there's still not an infrastructure coordination authority set up. Is that going to happen, or is that going to be run out of your department?
The detail of that kind of governance is also the subject of those negotiations with the Australian government. Obviously, their very significant investment means that they want to have confidence in the delivery model. So we'll again be able to say more about that once those those talks have concluded. In the meantime, my agency, State Development, is responsible for the delivery of the Olympic infrastructure, and we'll continue to do that. We've got a very deliberate process in place of project validation and market sounding, and each of our projects are at different stages of that process.
Do you think it would make more sense for it just to stay within your department rather than have an external authority?
Certainly I have confidence in State Development's ability to deliver on those projects, but we aren't the only party at the table, so it's important that we come up with a model that has the confidence of particularly the Australian Government. Everyone good? Thank you.
We're just going to do a little walk through the trees down that way.
Thank you.